Okay, it is now 2 o'clock. Aloha, everyone, and happy holidays. Thank you for joining us today. We're going to have maybe a short meeting. It's going over all the bills that were proposed and the top five contenders. So Alex will put up the results. Corey's not going to be with us today, so it's just me. And we will go over the bills that are part of the package. So Alex will give you the rundown of we had what? We had about 23. Um, Alex, do you have the chart with the votes? Hold on 1 second. Alex will show you the votes, and then we can go over the top five bills to prepare for our drafting agency. Alex, hold on 1 second. I wanted you to see the whole lineup. Oh, there it is. Okay. So here are the bills. The top five are the top five. So but here's the lineup of all the bills and how. Alex, can you go all the way down to, yeah, so all the way down to 23 bills. And you can see the lineup, and we have this if you would like a copy of that. Any questions before I proceed with the five proposals? Oh, so yeah, you can see how many people. Alex, do that again. So we had 203 total responses. Thank you, everybody. Oh, 282. Thank you, everybody. So 203 for the family caregiver tax credit. So and then for the fast tracking homes, 147 or 52%. The Kupuna Aloha program, this is the voluntary health services, the SHIPTA program, 115 responses, 40.7%. And statewide dementia training, 106 responses, or about 38%. And the final one is the freeze primary residence taxes for seniors at 36.5%. So these are the top five that made it. I mean, not to say that the other bills won't be introduced and would like your support on those that you have interest in. Oh, wait, we had one, two, three. No, these yeah, 1, 2, 3, 4, 5, right, up to freeze primary residencies. So I'd like to go through, unless there are questions, raise your hand if you have questions. I'd like to go through each one, and the sponsor can speak to it because what we're trying to do now is get it ready to send to the drafting agency. So, Alex, can you put up the first one? I think this one, Audrey, this is AARP's
Yes.
bill. We have this from last time. Do you have any changes to the SD2, which is the last bill that was in conference, I guess?
Yes. We'll work with you, Senator, and with the caucus. We'd like to make it a little more palatable or a little more receptive of in the situation that's facing the state with the budget. So we may modify the requesting amount for tax credit and then also making it clear as to what would be the eligible expenses so that it will be easier for the tax department to verify legitimate expenses when the claims come in. So there's a few minor administrative changes that we like to make on this particular bill. But again, we really appreciate everyone's support on this. We all know, right, the tax or the burden that many of our families are facing in terms of the financial expenses that they're incurring. And we know it's over $7,000 a year average. And so the growing numbers has now escalated to 260,000 family caregivers in Hawaii that are caring for loved ones, whether they're kapuna or younger adult children. Nevertheless, we know that they're doing their best to take care of their loved ones and keeping them at home. So thank you all for your support.
And thank you, Audrey and AARP, for continuing to push this forward. I know this is the third year. So
Yeah.
I think three is a charm, right? So if you will give us the information, work with Alex, and the sooner the better, because then we can send it out to the drafting agency and get that together. And again, once these bills are drafted, we will definitely send it around to everybody so you can see the final bill that's going to be introduced. Okay, thank you, Audrey. All right, moving on then to the next one, which is the fast tracking home modification permit. Is Katja Garrow here? Or anybody from Thrive for a Life? Okay, so this one is to fast track home modification permits. And now I'm not sure, is Debbie Morikawa on? So I'm not sure whether this is a state law or a county law because we're talking about permits. And when you talk permits, it's usually the county. So I would need to work with Thrive for Hawaii a little bit more to see what exactly they want. I will also follow up with Office of Healthcare Assurance, Debbie Morikawa, and see whether they have anything when they do assessments for residential homes. But this looks like it's for private homes. I don't know. John, do you want to add anything there? John McDermott's son. Oh, wait, something's wrong. We could try again. No, you sound like Donald Duck. Can you slow it down or I don't know what's wrong with, is it us? Try again. Oh, now you're muted. Okay, try now. Can you go loud? Can everybody hear, John?
Senator,
Uh,
I'm here, Damian Sempio from Thrive for Life as well. Sorry, I was on mute earlier.
oh, okay. Okay, so you're from Thrive for Life?
Yes.
Okay, Damien, you wanna speak to that because John is trying to, but I don't know, something's wrong with his
Yeah, I guess we're just looking
audio.
for the easiest or lowest hanging fruit, whether it's county as a pilot and then do it statewide.
Have you talked to anybody like in the administration side, like whether it's the county permitting of DPP, the Planning and Permitting Department,
Yes, we
or
did.
so,
Katia,
yeah,
yeah,
yep,
Katia, my business partner did. She was in communication with, I think, the director over there.
yeah.
And he said, yeah, he pretty much led us down the path of what's for what we have here as this bill. So she has the details behind it though.
Okay, can you send that to or contact Alex in my office? He's on this. He does all the coordinations. Just or send it to Sen Moriwaki at capital.hawaii.gov so that we
Okay.
can get more details before we send it to the drafting agency. And if in fact it's the county or we've got language from the county, because just, you know, as protocol, it's very difficult for the state to tell the counties what to do because they have this thing called home rule. So,
Okay.
so it would be good to have the county input so that when we do send it forward, they won't be opposing it. So I think
Okay.
that would be really helpful, what you
Um,
learned. And
uh,
John, are you
yeah.
back
So
on?
can you hear me now?
Yep.
Okay. So the only thing that I wanted to add is that we have quite a few people in nursing homes who they're admitted because, suddenly they had a heart attack, something terrible. And now they get some therapy and it's time for them to go home, but they can't go home because they need these modifications in the house. And yet the
Mm.
nursing home is saying that, well, we have to discharge you because you really don't qualify to be in a nursing home anymore. This becomes a really serious problem because, how do you widen hallways or put in a ramp, things like that, that you need as quickly as possible. And you didn't anticipate that you'd be in a nursing home. You didn't think you'd ever have a stroke or a heart attack. So I voted for this because I see this as a really critical need to move this as quickly as possible.
Okay, so Damien, maybe again, taking those kinds of things into consideration, that's even more justification for allowing this kind, I don't know, it's an exemption or it's a fast tracking, I don't know, provision. But let's work on that kind of sooner than later. So if you can contact Alex,
Sure.
my office,
Got
that'll
it.
be,
Thank you for the support, everyone.
yeah, very good. All right. And the next one is Jack Lewin on? Or somebody from SHPTA? Okay, I think this is Jack's bill, and it's I don't know if he has a bill, but we'll need to follow up with him. He needs funding for this kind of volunteer support for in-home services for kupuna who don't qualify for Medicaid and Medicare to get support, in-home support. So we'll talk to him, and again, we will send the final bills back to everybody once we get them drafted. And wait, am I following the right thing, Alex? I have freeze primary residence taxes. Is that, yeah.
Yes,
that one,
Senator.
I think, yeah. Okay, so that's number 4. Freeze primary residence tax. Again, this is sort of like a property tax thing. So this is like county, but is Gary Powell on? Okay. Anybody from the Caregiver Foundation? Okay, I guess this is another one we'll work with Gary on because this is another county proposal. This is property tax, which is county. So we will work with Caregiver Foundation and let you know what transpires. I think that's the top 5 bills. Anyone with any questions? Okay, no chat. Then there's a 6th bill. I mean, if in case any of these other bills don't go forward, like the county freeze primary residence might be. Oh, okay, we will go over the 2 bills again. Let me go over the 2 bills first. Alex, put the first bill up, which is the family caregiver tax credit. And this one, we already have a bill. It's going to be tweaked a little bit, as Audrey Suga Nakagawa said, in terms of making it more palatable in terms of the amount of credit that would be given. And that bill has been introduced and was in conference and almost passed, but did not. So we're revising it so that it might be more palatable in our days of fiscal constraints. So, and we will pass these bills around as soon as we get them back from the drafting agency. The second bill is fast tracking home modification permits. So as John has mentioned, these kinds of problems come up when seniors are being discharged or not being discharged or being discharged and not having the accommodations at home to home modification ramps or rails or whatever, and they have no way of getting that put into place, and they're going home without all of the accommodations that they need to stay safe at home. So we are going to work with Damien and Thrive for Life on getting a little bit more specific information, and then we will send it to the drafting agency. Garner, Representative Shabizo, I see your hand up. Do you have a question, or can you unmute and? Are
Thank you,
you?
Senator.
Yeah,
Sorry, had
yeah.
to unmute and stuff, but as John explained, I was wondering, is 30 to 40 days too long? Because in his scenario, if you're being discharged, unless you have advanced knowledge of what kind of repairs you need, and then you have to get it done, it's almost immediate in a sense. And I guess the related question would be, do we have a list of what would require a permit and what is, just things that don't require a permit? Because maybe, things like putting grab bars and stuff that I don't think that requires permit and stuff, but you know, um, of course, widening doors, putting ramps, I'm not sure if that does require a permit. Just a question.
So John or Damien, do you have any more specific information on what is modification? Your definition of modification?
Yeah, the
Oh, yeah.
Department of Permitting says anything over $1,000 um would require permit. There are some nuances to that, but specifically any new anything new structurally, such as new walls or anything new or adapted or anything that's adapted to electrical and plumbing. So if plumbing needs to be moved or electrical needs to be moved, but if you're just changing out existing finishes or changing out existing electrical, then that usually does not require a permit. So there are pretty clear guidelines, but yeah, we'll provide specifics for it as well.
The timing, I think that's a very good question. People who are in a nursing home, the first 20 days Medicare, covers the therapy. So a lot of our seniors do stay in the nursing home for that first 20 days. On the 21st day, that's when the payment source is different. And so, I mean, it would be nice if all of our seniors thought about aging in place and things that you need to do with your home before you had that heart attack or before you had that stroke. But that's just not the way everybody thinks. And so you go to the nursing home, and now your family's in a panic because they're thinking she can't go back to the house because it's not ready, and she can't come to my house because I don't have any room for her. So they're really now struggling to get things in order because the nursing home is going to say, you no longer qualify to be here. Insurance is no longer going to pay for you, so you have to go. And it doesn't matter that your house is not ready. That's your problem. Insurance is only going to pay for you to stay in the nursing home if you need nursing care. So I get these phone calls all the time about, can I help them to appeal the discharge? And no, if the discharge is that your house is not ready, that's not really a legitimate reason to stay in a nursing home. So anything that can speed up the process is going to be very important.
Mhm.
I see Representative Yamamoto, you have a question or comment?
Yeah, thank you, Representative Moriwaki. If in fact 2 of the top 5 bills are county issues, should we discuss the next 2 bills on the top vote list?
Hi, this is just a point of information, Senator. This is Jack Lewin. Whenever you're ready, I'm done with my presentation at the Healthy Hawaii Summit. So anytime, I apologize for being late.
Okay, we just covered your Kupuna Aloha program. It was one of
Okay.
the top 5. So do you want to tell us a little bit about it? Do you have a bill ready for us to use to send down to our drafting agency?
Yes, we do, and we're ready. And what we have with Kupuna Aloha is a combination of things that we think could be particularly helpful right now to the state. We think we're using all the volunteer organizations in the state already, like Project Dana, Hui o Haula, and others, to mobilize volunteers. But this program will vet, train, and then empower volunteers with iPads and as frontline workers to visit Kupuna in their homes. And they will be connected with no delay to advanced practice nurses and social workers for any questions or interests that they have. all connected to a kind of community hub model around keeping those kupuna well at home, deciding when they need to go in to see the doctor, or when a telemedicine visit works just as well. So we're using technology, and the volunteers at the front end, where we have community health workers, we'll use them. But where we, in so many places, do not have enough community health workers, we'll use the volunteers. But here's the thing, the volunteers can also qualify to be putting in their volunteer time or be employed as trainees for community health workers when they're laid off from Medicaid benefits. So if in fact the work requirements in Medicaid cause, thousands of our beneficiaries to lose their coverage, this is a way they can retain it. And we're making a program that can work in that way, and also keeps, helps our kupuna stay well at home and take the burden off their family. So
Jack, is there an appropriation or any positions that you're asking in this bill?
Well, Senator, I am hoping that this will be entirely funded by the Rural Health Transformation Program for the next 5 years, so that we don't have to ask for an appropriation. It's a great use for that money, and the governor's team liked it. So hopefully it will get funded. But if not, we're going to look for a way there. The person who wants to kind of really help make this work is Duan Langwan, who runs Vivia, a very large home health agency. She's working with our fellow home health agencies to say they can be the people who actually evaluate each patient who's referred to the program, and make sure that professional part of that's done, so that. And there's some other factors that I can tell you about later. I don't want to take up too much time in the meeting. We want to make sure we have all the medical records for all the patients in this program, so that, and we're really tracking all the problems and tracking all the risk factors. So anyhow, we think it's a great model. We want to try it and see how well it works. But at this point, if we're lucky, we don't need any additional state funds to make it work. We can use Rural Health Transformation.
So Jack,
I'm Powell.
you have a bill that you can give to us, or is this part of the administration package, or what is
It's
this?
part of it's part of the administration package right now. But to be safe, I'm gonna come up with a bill and make sure it's available to you. So we will make sure we have a backup bill, but we're hoping for Rural Health Transformation to fund the entire project.
Okay. Okay, thank you. Any
You're welcome.
questions of Jack? Yeah, any questions of Jack? Okay. Oh, so is Kobe around? I think I got something from Kobe. So we can go back to the statewide dementia training. Kobe, that's Alzheimer's Association? Kobe?
Hi, Senator. Yes, I'm
Yeah,
here.
you want to talk about this?
Yeah, so this is our bill, as we mentioned when we proposed it. It's really seeking to get first responders trained in dementia, how to recognize potential cases, and how to communicate effectively to keep our kupuna safe, especially those impacted in the later stages where they might be very confused of situations. So we do have some notes ready for you folks to send down to the drafters for drafting. But otherwise, I'm here for any other questions.
Okay. And so excuse me, I just got a note from Alex. But so you say you have a bill, or at least the bullet points for a bill?
Yes, we have the outline of something. Yes.
Okay, so you can submit that to us more specifically. And is there any appropriation requested, or this is everybody does it? Oh,
Yeah,
it's
there's no
mandatory.
appropriation requested for this.
No appropriation.
No appropriation.
Okay. Okay. All right. So if you can send what you have, bullet points or whatever, to Alex, then we can proceed with getting that drafted.
Will do. Thank you, Senator.
Thank you. Okay, so let's see. So what Alex tells me is the two county bills can be made into state laws, but the request by Representative Iwamoto is to take the next two down the list, and we'll just include that in case we don't get we can't get it through. It's too complicated. Okay, so the next two, one is the Kupuna Rent Supplement Program, for which we have a bill already. But I was just talking to a speaker, and he's very interested in the shallow subsidy, not only for Kupuna, but for everybody, especially during these times, that we probably will look at getting some information from the public HPHA, Hawaii Public Housing Authority, to see, who administers it, to see whether we can get a report on the need. So what is the waiting list? I don't think they collect a waiting list, but we'd like to include that so we know, how much we should be appropriating. But right now for the Kupuna, I don't know. I need to check with the director to see how many are on their regular rent supplement program, because we put in $1 million for 2 years for the Kupuna rent supplement, but looking at it in a more totality of the needs, that we might want to increase the shallow subsidy because it's more cost effective than building another building. So I just wanted to let you know that's something in the making of maybe amending the bill beyond what we have now, which was really $1 million for 2 years, and we're just extending it to make it permanent. And the next one after that is the state plan for hearing loss.
Yes, hi, Senator. This is Tori Carapello, and thank you so much.
Okay, Tori. Yeah.
So through this bill, we hope to be able to assess our hearing health landscape, really being able to identify where those gaps are: screening, care, access, workforce, and affordability, and then engaging the stakeholders to be able to gather data on prevalence, capacity, and need. From there, we'd be able to make recommendations on an actionable roadmap to identify solutions.
And you gave us a bill, right? You have something that we could
we have a preliminary draft already.
Okay. So if you can send that to us, we can send it to the drafting agency as well. Is there an appropriate? I thought I recall appropriation.
Yes, we had added some appropriation for that, working with the state office.
Okay, this is a state office of disabilities or state office of aging.
We're actually in conversations right now, so I'll be able to give you more details in a little bit.
Okay. Okay. Yeah, because so if it is a bill with actions required, then usually it would go to an administering agency, whether it's DCAB or it's EOA. That should be identified.
Correct. Yeah, that's in the works right now.
Okay. Okay. Well, when you've got it together, then send us what you have.
Okay, I'll send that over.
Okay. So if the two county bills don't pan out, they're too complicated, then we will move toward these two additional bills that we just discussed. Okay. Is there anything else that you would like to discuss? Because I think that is it. We are going to now take all of these bills, and those of you who have follow-up work to do, if you could send it to us, and as soon as we get it from you, we will send it to the drafting agency, and the next meeting in January, we will give you the final bills that we are introducing. And Representative Chun isn't here, but I think that he will be able to introduce it on the House side, and I will introduce it on the Senate side. Unless you folks have your own, you have other legislators who are championing it, then you can ask them to also introduce it. Okay, Rep. Iwamoto.
Yeah, thank you. Senator Moriwaki, as Vice Chair of Finance, how important is it that, for instance, many of the kupuna bills that are part of your package do require tax revenue to adequately fund some of these services and subsidies? Is it important that those who care about kupuna also then testify in support of any of bills that would raise revenue so that we can meet these needs? Is that appropriate to kind of underscore that, like as bills start being proposed and moving, that would actually then allow us the funding to support these kupuna bills? Is that appropriate or is that useful, do you think, as
Well, yeah, I think everybody, and we have about 200 members active, as you saw, who voted for these bills. Everyone on the Kupuna Caucus can look at all the bills, and if there are bills that could be brought up and discussed at one of our meetings quickly, then each agency or individuals can testify on those bills. As to the Kupuna Caucus bills, we are because of the House, we have in our package limited to 5 bills, and that's why we have the process we do, where we give out all the proposals that come in and people vote on them, and then those go forward. So the package itself is 5 bills. It does not preclude everybody supporting these other bills. And so, in fact, everybody has supported other bills that are, that have been discussed. But if it comes to the caucus, then we require that, as Mel did with the Long-Term Care Advisory Commission, that you come forward and discuss it so that people can have a time to vet it. Okay. Any other questions or comments? Let's see. We went over the first 2 bills. Caroline is okay, the cost of the job in order for doing the modifications. And then Roberta Hickey, I'm not sure what that means. The mediation center cannot hear. So I'm not sure if that's still a problem. Can everybody hear our discussions?
That was just an issue with John earlier. So
we're
good.
Okay. All right. Okay. So anything else? Okay, then I think we have concluded our business for today. And I want to thank everybody who proposed and everybody who voted. And I wish you all Merry Christmas, Happy New Year. We will get back together in the new year, 2026. And those of you who have homework, please send it to our office, and the sooner we can do that, we can get this the bills drafted and ready for introduction. The session will start the 3rd week in January, the 3rd Wednesday in January, and bills will start being introduced thereafter. And we should see it getting faster.
So, Senator, the next meeting is January 9th then, right? Because the first Friday would be the first.
Yeah, the first Friday, right.
Thank you.
Okay. So thank you all very much.
Thank you, everybody.
All
Merry Christmas.
Merry Christmas.
Thank
you,
you.
Senator.
Thank you.
Thank you.
Thank you.